Okay, so today is the SUBQ injection and the IM injection. I've looked at my patient's MAR, their medication administration record. They have 3 different prescriptions on there. One is for a 50 milligrams of metoprolol or something at bedtime. There's also one for Zyprexa at as needed, 1 milliliter of Zyprexa as needed for agitation, and then there's 3 units of Humulin, which is insulin, after lunch. So first, I'm just gonna say that my patient's really agitated, and that we're gonna give 1 milliliter of the Zyprexa to help our patient calm down. So I've got my patient here. I'm going to start first with using 2 identifications to identify my patient using patient name and date of birth. I'm going to have my patient state their name, date of birth, and while they're doing that, I'm going to check their ID bracelet to confirm those. And also, I'm going to confirm any allergies, but in this patient's record, all I saw was seasonal allergies just to hay. So that's not an allergy we're really concerned with here. And then I'm also going to ask the patient if they've taken this medication before and if they had any severe side effects or anything in that matter. So to get ready, again, we identified the patient. We made sure everything is good to go. So I'm going to do my rights of medication. So I'm going to do right dose, or right med, right dose, right patient, right route, right time, and right documentation. So we're gonna do our rights of medication administration. And then I'm gonna go into the patient's, or while I'm in the patient's room, whatever. I'm gonna first start by washing my hands and applying gloves. I don't have gloves, so we're just gonna pretend. So I'm gonna get my IM injection, the 3-liter 22 gauge needle. I'm going to open it up. I'm not going to open it up all the way. And I'm going to prepare my vial. So we're going to pretend this is a vial of Zyprexa. And the MAR calls for 1 milliliter. So I'm going to, I always do that, take the needle top off. And then I'm going to draw 1 milliliter of air, stick it into the vial, blow out that 1 milliliter of air, tip the vial upside down, and again draw 1 milliliter of Zyprexa. So I'm going to pretend I put this on the clean area. So we're going to put the cap back on here just while we're getting everything ready. So I'm also gonna tell the patient that this is gonna be injected in either like the butt area, or like we said in the video, we can split the thigh into 3 sections, and then it would go in the middle section where most of the muscle is. So I'm going to pretend that I have alcohol wipes. I didn't see any in the lab bag, so I'm just going to pretend this is an alcohol wipe. So I wiped it open. So I'm going to clean the area that I'm going to inject into, either on the side of the glute or the middle part of the thigh in the 3 sections that we discussed. I'm going to wipe down, clean the area for about 20-30 seconds. Make sure I get it good and clean. So then I'm going to take the medication, and wherever I'm injecting it, I'm going to kind of pinch the skin, and then I'm going to take the patient, or tell the patient to take a deep breath, and then I'm going to dart the needle in and insert the medication. And then I'm going to kind of hold it there for just a second, make sure it goes in, take needle out, and then I'm going to grab a cotton ball and I'm going to hold pressure over the injection site to make sure it stops bleeding. And I'm going to flip this up immediately after I give the injection. So I'm going to hold pressure on there, or I'm going to put a Band-Aid over it, whichever. And then I'm going to dispose of the needle in a sharps container. Right now, this is my sharps container. Okay. So now we're going to say it's after lunch. My patient ate. And I'll document how the patient reacts to the Zyprexa. I think that's about it. And then, so again, now we're going to pretend it's after lunch. So now we're going to get ready to do our SUBQ injections. So I'm going to make sure I have everything. Okay, so again, we're going to do our rights of medication administration. So right med, right dose, right patient, right route, right time, and right documentation on the medication. Also going to go into the patient's room. Again, have the patient state, name, date of birth, while I'm verifying that on the patient's ID bracelet. And then I'm also gonna make sure there's not any allergies again and again, just seasonal allergies. Hey, nothing to be concerned with. Since the patient is diabetic and is taking insulin, I'm guessing the patient's had insulin before. And sorry, my dogs. Since sorry, I was trying to make them be quiet. So since the patient is diabetic, I'm guessing they've taken insulin before, so I don't think we really need to ask that. So I've verified my patient, verified my medication administration rights. Now I'm going to do my hand hygiene, put my gloves on, and then I'm going to get ready to inject or set my injection up. So I'm going to take this off, set it on a clean surface. So the MAR states that we need 3 units of insulin. So I'm going to draw 3 units of air, stick it into the vial, blow it out, tip this upside down, and draw 3 units of insulin. So I'm going to put the lid back on here just for a little bit. And then I'm going to get my patient ready. So with SUBQ injections, we mostly do the abdomen or the fatty part of the arm. So here I'm just going to say that I'm going to do it on my patient's abdomen. So I'm going to pinch the skin of the patient that I'm doing the medication administration on. And then I'm going to go in at a 90-degree angle, just like I did with my IM injection. And then I'm going to dart the med in, push the 3 units of insulin, pull it out. I'm going to hold, I'm going to put the cap back on. And then I'm going to hold a cotton ball on there. Also, I would have cleaned the patient's skin for 20 to 30 seconds with alcohol wipe too before I gave the drug. I think that's all. I'm going to document that I gave the patient insulin. I'm going to get a nurse to verify that I gave the insulin and the documenting. And then I'm going to take my gloves off, wash my hands, and then make sure the patient has their call light, the bed's lowered all the way, make sure they have everything they need before I leave the room and go do something else. So, thank you.